Hello, I'm Jerry Huang from University of Washington. I will be demonstrating intramedullary fixation of a metacarpal fracture using the OSSIOfiber threaded nail. Before opening the OSSIOfiber threaded nail, it's really important to make sure you have the adequate sizing for this. There is a OSSIOfiber nail sizing guide which allows you to size for both a 4.5 and a 5.5 millimeter nail. So there are two sizing guides. One is a 4.5, which is a medium. One is a 5.5, which is a large. It's really important to make sure you put the template against the actual handle you'll be working on. As you look at the template here, it's really a silhouette of the actual implant itself with both the outer diameter threads and also the core diameter threads as well. So what we're looking for right now is looking at the size of the canal and making sure that it fits within the canal, but also that you do have an interference fit of the actual nail with the actual cortex itself on the metacarpal. As you look at the sizing guide, there are also markings on there which are at 10 millimeter calibration. So each larger thread is at 10, 20, 30, 40, 50, and 60. So it gives you an idea ahead of time what size nail you'll be using as far as the length. Before we start, I'm going to overlay the sizing template directly on top of the metacarpal that I'll be working on. You're looking at the floral shot here, you can see that the silhouette fits really nicely within the medullary canal of the fifth metacarpal. And you can see as I kind of line this up and center this, I want to make sure that one, the core diameter is going to fit inside the canal really nicely, and two, the outer threads is going to give me some purchase and interference fit within the medullary canal. There's also some really nice sizing markers on there. So again, they're at 10 millimeter calibration. So in this particular patient, we're probably looking at a nail that's between 40 and 50 millimeters in length. As we're looking at nail positioning, we're looking at countersinking the nail approximately 2-3 millimeters below the articular surface. Another trick for doing this is actually using a hemostat, as I've shown here, and actually clamping the sizing template at the level you think you want your nail to be at as far as sizing, and putting it against the floral shot. As you can see here, the hemostat is right below the metacarpal head, right at the subchondral surface. So it gives me an idea at what level I want to make the cut on my threaded nail. All right, the OSSIOfiber threaded nail comes as a disposable set with 4 simple instruments. The 1.1 millimeter guide pin. You have the cannulated drill, which is sized at 3.9 millimeters, which is really optimized for metacarpal fixation, which matches really closely with the core diameter of the nail itself. You have an adjustable threaded screwdriver as well, and the sharpener, which lets you sharpen the final product on the threaded nail. This procedure could be performed percutaneously versus making a small incision over the 5th MCP joint. It's really a surgeon preference. I prefer to do these percutaneously. This is the 1.1 millimeter guide pin. And I'm going to place this directly over the MCP joint. The MCP joint is going to be flexed at about 90 degrees. As far as guide pin placement, you want to be centered on the AP shot. Make sure your radial ulnar position is right down the middle for the metacarpal head. On the lateral, you want to be over the dorsal 1/3 of the articular surface. Once you're happy with the guide pin placement, you're going to advance the guide pin right through the fracture site. This time you got to do a closed reduction or make a small percutaneous incision over the fracture site to assist in your reduction. Most metacarpal neck and shaft fractures can be reduced in a closed fashion. However, certain cases with combination, shortening, or significant displacement, you might have to make a small incision over the metacarpal shaft to assist in reduction. Once the guide wire has been advanced past the fracture site, it's really important to make sure you see the guide pin right at the base of the metacarpal. It's oftentimes best to go to the base of the metacarpal and oftentimes across the CMC joint so that during drilling, the guide pin does not dislodge or displace. Once you're happy with the guide pin placement, I generally make a small stab incision right over the MCP joint, just enough to accommodate the drill as well as the threaded nail. Again, this is really a surgeon preference. You can make a mini incision over the MCP joint if you like and retract the extensor mechanism, but typically I do these percutaneously. All right, so we're gonna start drilling. So this drill does have markers on there, marked at 30, 40, 50, and 60. In this particular patient, we're looking at about a 45mm threaded nail. It's really important that you drill past the isthmus, so the canal right in the middle is very, very tight. So ideally you want to drill the entire length of the metacarpal, but it's really critical to make sure you drill past the entire length of the isthmus of the medullary canal. So when I drill, I do this under fluoroscopic imaging, as the guide pin does shift within the medullary canal, so you want to make sure that your drill is centered on the metacarpal shaft as you're going down the pike. As we drill, we're going to be drilling right through the entire length of the isthmus, right down to metacarpal base, making sure that you don't penetrate the base of the metacarpal. For the OSSIOfiber threaded nail, it comes in one size. It's a 4.5mm nail that's 70mm in length. And really the versatility of this system is the nail could be trimmed to any length that you want. You can really customize the length to any metacarpal based on your preoperative measurement. So as far as some of the characteristics of the nail, it's a variable pitch nail with also a graduating diameter. If you look at the distal part of the nail, it's a wider pitch. The more proximal portion is more narrow pitch. And also the diameter does taper going from proximal to distal. It's really over that most proximal 10mm where you have the variable pitch and also the graduated diameter as well. So this is a 70mm nail that could be trimmed to be as short as a 20mm nail, depending on your clinical indication. So before we started, we used a sizing template and put a hemostat right at the appropriate length so that the nail is going to seat right at the metacarpal head, countersinking approximately 2mm. So based on that marking, I'm going to now take my threaded nail right against that and make a marking right at the tip of that so it's the right length. Now we're going to put the threaded nail against the sizing template and make a marking. And this is where we're going to be making the cut. Again, one of the benefits of this system, it's very versatile, so you could cut this nail to be whatever length you need based on preoperative measurements. Once we mark the thread nail at the appropriate length, we're now going to cut the nail using the oscillating saw. You can hold two ends with a hemostat. So next step is sharpening the nail on the cut end. This is the adjustable screwdriver. It's a cantilever screwdriver that will go down the threaded nail, allow for cutting at the appropriate length and sharpening as well. So you can see on here that it is calibrated. So preoperatively we measured this to be a 45mm nail. So you could actually adjust this so it goes back and forth. So it's right at 45mm. Alternatively, you could actually let it go fairly long, say to 70. Let the nail go directly on top of the adjustable screwdriver, and you actually let it just kind of sit flush, and actually will go flush against the end of the barrel on the adjustable screwdriver. This is a sharpener that comes on the set, so now that the cantilever screwdriver has been inserted into the threaded nail, we're going to sharpen the very end so we have a nice sharp end to work with. You do want to actually put a little bit of resistance on here. You do want to push a little bit hard so you can get a nice freshly cut end on the threaded nail. As far as sharpening, knowing when to stop, you really want to push firmly on the sharpener until no more shavings come out. That's when you know you're done. You have a nice flush cut end on the threaded nail. So you do want to give it a little bit of a push initially on insertion, just really get past the metacarpal head, but afterwards it should go down fairly easily. I would recommend pre-drilling for all cases, unless you have somebody who's fairly osteopenic with a very big canal, but in general you do want to pre-drill on every single patient. As you insert the threaded nail, it's really important to make sure you seat it at the appropriate length. This is a cantilevered screwdriver, so even though the actual OSSIOfiber threaded nail is radiolucent, you can really use the cannulation on the screwdriver to see where your nail is going to be seated. On this fluoro image, you can see the very, very tip of the screwdriver where it ends on the metacarpal base. And right at the metacarpal neck level, you can see also the barrel where the nail is now countersunk within the metacarpal head. So you really want to try and countersink this approximately 2 to 3 millimeters below the articular surface. Once we're done with nail fixation, we want to check for stability of our construct, both for bending as well as rotational stability. Now under fluoroscopic imaging, we're going to check for stability of our construct. So now we're checking for translational stability, looking for dorsal volar translation. It feels very stable. I have a ladder right now. Again, you can see the metacarpal neck feels very stable as far as dorsal volar translation. And last part right now, we're going to look for rotational stability. So at the fluoroscopic imaging, again, we'll look for any rotational stability. This feels nice and stable there. Lastly, I'm actually going to distract the small figure right now. You can see even with distraction, there's really no distraction or gapping at the fracture site. Really demonstrated really nice compression with the OSSIOfiber threaded nail. The OSSIOfiber threaded nail is a really unique system for intramedullary fixation metacarpal fractures for multiple reasons. One, it's a disposable set that's very simple with 4 instruments. It's a one-size-fits-all, a 4.5 by 70 millimeter nail. It's a biointegrative implant, which has many advantages, including no worries about implants needing to be removed for any cases of revision surgery, no concerns of implant breakage and trying to remove the implant. And also, certainly in adolescents and kids, there's the advantage of having something that's biointegrated and not a permanent implant that you have to worry about down the road.